Opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Nashville and the state of Tennessee. Welcome to the 16th year of the Ask the Expert show, where we bring you the finest experts in the field of legal, health, financial, and home improvement. We have got an incredible show for you today. Dear to my heart, we are talking about eye surgery, but mainly cataracts. I got to tell you, we get more letters from listeners asking us to do a show on cataracts, which we did probably about 4 or 5 months ago. But it is, since we have a little bit older audience, it is so important that we do a show on cataracts like we're doing today. And we have, I got to tell you, we were so lucky to get Wang Vision Institute. They are the top eye surgeons in the state of Tennessee. And one of our favorites is with us today, Dr. G. Good morning, Dr. G.
Good morning, Steve. Thanks for having us. I mean, it's always a pleasure to come out here and kind of educate patients. It's really our pleasure.
Well, I got to tell you, the people love the way you break things down for them because, we're all laymen here, and sometimes we get a doctor on that I have no idea what they're talking about, but people
Sure.
love the way you break things down.
Thank you.
So let's start off because we get so many new listeners.
Yes.
Tell
100%.
people about Wang Vision Institute.
Yeah, so Wang Vision Institute is one of the premier ophthalmology practices here in the Nashville area. We've been in practice for about 20 years. So we kind of are at the forefront of the technology that ophthalmology has to offer. And we do a lot of what is called premium cataract surgery and refractive surgery. So we do about 8 different surgeries to help patients out of glasses. But, our kind of bread and butter is cataracts. So we are specialists in the field of cataract surgery. And a lot of people are referred to us and kind of fly all over for cataract surgery.
Yeah, it's usually a little bit older demographics, right?
Yeah, we could talk about exactly what a cataract is. So just like a camera has a lens, our eyeballs have a lens inside of the eye. Now that lens, as we age, does 2 things. One, as we get closer and closer to 40, around 42, that lens becomes very stiff. And when that lens becomes stiff, that's when we lose the ability to kind of autofocus and we start needing some readers, some cheaters, bifocals, progressives. Over time, that same lens, not only does it start to become stiff, it starts to become very cloudy, opaque, kind of gray like our hair. And that's what's called a cataract. So a cataract is a natural clouding of our lens inside of the eye. So it can cause difficulty driving in the rain, dim conditions, foggy conditions. It can cause a lot more glare and halos, starbursts around headlights, just decrease the overall quality of your vision. To your point, I mean, is it only older people that kind of get cataracts? Cataract surgery is prominent as we get older. So most of the time, the older we get, the bigger the cataract gets. But some people are even born with cataracts. There's what's called congenital cataracts. People with certain medical conditions like diabetes, people that have had a history of steroid use or radiation, these people can develop cataracts much sooner. Similarly, people that are very nearsighted, kind of wearing those Coke bottle glasses, they also develop cataracts much sooner. So there's a lot of different medical things that can cause people to develop cataracts earlier, but typically the older we get, the bigger the cataracts get.
So we started promoting that you're coming on a couple days ago. So we started
Perfect.
getting emails. And the two biggest questions were, how long is the procedure? Is it painful? And can I go to work the next day? Those are the three biggest questions.
Yes, all very, very good questions. So, cataract surgery is same day surgery. Here in the state of Tennessee, we have to do one eye at a time. So, typically, each eye takes about 15 minutes. So, the way that we do it, we do have an anesthesiologist kind of on standby. And what their job is to do is to help make you feel comfortable. So, there's no pain, there's no sharp pain. You feel a little bit of pressure, you feel a little bit of manipulation, but everything is well controlled so that you don't really feel anything at all. Takes about 15 minutes. For all of our surgeries, we use what's called a laser. So probably only about 5% of practices even have access to the laser. And we have access to the newest laser, and we like to use it for all of our cases. So it adds an extra level of safety and efficiency to the procedure where we can use the laser rather than a manual blade for certain steps. In terms of recovery, I tell most patients by the next day they're going to be functional. It's still going to be, you can't expect a pitcher to be pitching the next day after elbow surgery. Now, this is your eyes. So there is going to be some swelling. There is going to be some inflammation, but typically you're going to be functional. We try to close all the wounds without a stitch. So for that reason, we say for about 10 days, no heavy lifting, bending, or straining. You don't want to lift anything and increase pressure to that eye that can open up that wound. The bulk of the healing is typically done within a week or two. And since we only do one eye at a time, patients oftentimes go back to work the next day.
And there's no pain at all?
Correct. So there's an anesthesiologist that's kind of on standby to help make sure you're feeling comfortable, help with the nerves, but you're still awake because sometimes we're going to need you to look up, look right. You do feel some pressure, you do feel some manipulation, you'll feel some fluid on the eye, but really you will not have any sharp pain.
Mary, also in Nashville, wants to know, when I'm driving at night and I look at a light, it looks like there's like a starburst. Is that what you're talking about?
Yeah, 100%. That's kind of a hallmark textbook symptom of cataracts.
And what happens if a person doesn't take care of it? Does it progressively get worse?
That's right. So cataracts, they progressively get more and more cloudy. And if you let them go, they can turn into what are called white cataracts. So where the lens inside the eye essentially becomes very hard, very opaque, very dense, and just becomes super white. And at that point, it's going to be very hard for you to see at all. Allowing cataracts to get that stage not only makes it difficult for the patient to see, but it actually makes the surge infinitely harder as well. In fact, cataracts is kind of the leading cause of blindness worldwide.
Wow.
Here, that's right. Here, kind of in the U.S., we're very good at detecting cataracts earlier and kind of managing them earlier. But worldwide, it's still the leading cause of blindness because patients don't have access and they just let the cataract kind of get bigger and bigger, really limiting their vision.
Can a young person get cataracts?
Yes. There's certain medical conditions that can cause younger people to develop cataracts. Like if they're diabetic, they can get cataracts earlier. Trauma, if they have a history of ocular trauma or injury, they can get cataracts earlier. Some people with the family history just develop cataracts a little bit sooner. some people with a history of radiation or steroid use, autoimmune conditions, all those patients can also develop cataracts earlier.
What about lifestyle factors like sun exposure? Now you mentioned diabetes. What about like smoking? Do those increase
Yeah.
risk?
Yes. Very good questions. Very good questions. So kind of for cataracts, there's what's called modifiable risk factors and non-modifiable risk factors. So a lot of things out of our control is the natural aging process, our genetics, family history. The only two things that we can do from our standpoint is kind of sunglasses whenever we're out in the sun. That can help reduce some of the UV exposure and slow down the development of cataracts. And then two, if you're smoking, to quit smoking. So both of those two things are shown to help progress cataracts, but they're going to also naturally progress with age.
How do you, when you're diagnosing cataracts, is it is a machine that actually does it, or do you look into their eyes? How do you find out if someone has cataracts once they come into your office?
Yeah, very good question. So there's two components to it. We have a subjective component, and then we have an objective component when we're kind of looking at these cataracts. So from a subjective component, we have all these patients take what's essentially a cataract questionnaire that screens for symptoms of the cataracts. So that talks about the progressive glare and halos, the difficulty seeing at nighttime, the difficulty seeing in dim conditions. And then objectively, like you noted, we actually look inside the patient's eyes. So the cataract or the natural lens of the eye sits behind the pupil or the colored part of the eye. So what we do is we dilate that pupil so we can get a really good look at that cataract. Cataracts are graded kind of on a scale of 1 to 4 plus, 4 being the worst, 1 being the mild. So we're able to actually take a look and see at what stage the cataract is. And then we're actually even able to recreate nighttime conditions in the office to get a quantitative assessment of how bad the cataract is affecting you.
What about, can cataracts be treated with glasses or medication, or is it just the surgery is the only option?
Yeah. So cataracts, as we get older, that cataract gets bigger and gets more gray and cloudy. And as that continues to happen, it will continue to change the prescription of the glasses. So while you can get a new prescription and it can help you a little bit, ultimately, even when the glasses on top of the eye, you're still looking through a cloudy lens in the eye. So the glasses really can't fix the cataracts. It can maybe help you see a little bit better, but currently with everything that we have, there's no pills, there's no glasses, there's really no non-surgical interventions for cataracts. The only way to do it is cataract surgery.
What about, is there any side effects? We just got a text in and asked that question. Are there any side effects at all?
Good question. So cataract surgery, just like it's the leading cause of blindness, it's also the most commonly widely performed surgery worldwide for that reason. So it's a very highly effective, very safe procedure. So overall, very minimal side effects. But as with any surgery, it is still a surgery. So there is always a risk of what we call infection, retinal tears, detachments, risks for need for second surgery. But all these risks are less than 1%. The biggest kind of side effect is most patients get a little bit more dry for about a month after the surgery, but then the dryness goes back to their baseline.
Aren't there different types of lenses, implants that are available?
That's right. So the cataract sits inside the eye, kind of like a chocolate M&M suspended by little ropes. When we do the surgery, what we do is we remove the front part of the M&M shell, go in there, take out all the chocolate, that being the cataract, put a brand new lens in that same M&M shell. So when we replace the chocolate with the lens, there's different options out there. So some lenses can eliminate the need for glasses completely. So you don't need any glasses to correct your astigmatism, nearsightedness, farsightedness. There's different options where you can just correct just the astigmatism and have excellent distance where you don't need any readers. And then there's different lenses that kind of fall in between. So yes, there's multiple options for types of lenses. It really just depends on the patient's individual lifestyles and goals.
Does insurance cover all the different types of implants?
Unfortunately, no. So
Uh,
insurance says if you can see with glasses, they're not gonna do anything to get rid of glasses. So insurance will pay for what's called a monofocal lens. So they will pay
okay.
to get rid of the chocolate and put a brand new lens in there, but you'll still need glasses. So through the glasses, the vision will still be really sharp and not cloudy anymore because the cataract is not there, but you'll still need glasses. But anything where you wanted to kind of reduce your glasses dependency, insurance won't cover. So, say you have a lot of astigmatism and you wanted to correct the astigmatism with the lenses inside the eye rather than wearing glasses. So, we can do that for you. And then the astigmatism is corrected and you don't need the glasses, but insurance won't cover that. Similarly, after cataract surgery, patients will need reading glasses. But if you don't want to wear readers, we can do that for you. We can essentially put in a progressive lens or like a bifocal lens inside of the eye. So that gives you kind of everything. But again, insurance won't cover
Yeah, figures. uh, what about, listen, I know Wang has all the advanced technology. Are there
That's right.
advanced options that reduce dependency on glasses uh, after
Yeah.
cataract surgery?
Yes, 100%. There is multiple options. In fact, the newest lens that Les launched nationwide, we were one of the few, I was one of the few surgeons, 30 surgeons kind of worldwide that had early access to that lens before it even launched. So we're kind of at the forefront of that technology. So the way that it works is kind of like it's called a multifocal lens. Different manufacturers make them. But just like people can wear a progressive lens, the multifocal lens, what it does is it focuses light at different focal lengths to give patients the full range of vision. So they're able to see up close, they're able to see their phone, their watch, they're able to see the dashboard, and they're able to see the distance all without needing any glasses.
Well, hey, Dr. G, we just got a text in. A lady from Nashville. She said, Wang has got an incredible reputation. Can you ask your expert some of the new things that are going to be coming out?
Yeah, good question. So technology is always changing. So like what I was saying with this multifocal iteration, the first multifocal was launched over a decade ago, but this newest version that we just had just launched about a few months ago. So multifocal technology keeps changing. So the technology that keeps changing, because one of the side effects of the multifocal lens is some patients can have a little bit of glare and halos, but with the newest iterations, it minimizes even that. Other options are coming out in the future, what are called accommodating lenses. So once we put the lens in there, the lens can autofocus depending on different focal lengths. So different clinical trials are being studied right now for that lens. There's also different kinds of adjustable lenses coming out, meaning once we put the lens in, if you're not quite happy with what it's doing, we can adjust it non-surgically, and we don't have to go back in the eye to modify it to kind of help what you need. So all those are kind of coming out on the horizon.
What about I guess the best advice to give a patient to protect their vision long term, even after cataract surgery? What do you advise?
Yeah. So even after cataract surgery, kind of the best advice for overall eye health is kind of what I call daily maintenance. So simple things, just like whenever you're outside wearing sunglasses, um, getting your annual eye checkup. A lot of people ignore eye health and don't come in until it's too late. But we recommend annual eye exams because we screen for a lot of things. So we screen for things like macular degeneration. We screen things for like glaucoma. Glaucoma is a silent disease, meaning it starts to affect patients' peripheral vision loss. And by the time they've come in, they've come in because it's affected their central vision loss now. So one of the reasons we recommend annual eye exams is because we want to screen for glaucoma and catch it early so it never progresses. Similarly, just like we can get moles on our skin and our face, we can get moles in the eye. So we can get moles on the eyelids, we can get moles on the retina. Some are benign, but then some have to be biopsied. So for that reason, another thing that you can really do is kind of get general eye exams. Lastly, the thing that happens as we get older, even after cataract surgery, is just like our skin dries out, our eyes dry out. So things that we could do at home are what are called warm compresses, giving your eyes a break. A lot of people spend a lot of time on computers and phones with our technology nowadays. So that has increased the prevalence of dry eye. So there's something called the 20-20 rule. For every 20 minutes of near work, computer work, you want to look at something 20 feet away for about 20 seconds to give the eyes a rest and kind of let the tear film kind of lubricate the eye again.
I got to tell you, every time we do a show each month, I'm always amazed. And you would not believe that we've had so many questions. There's one more question I want to get in. We just had a mother write in. Does Wang Eye Institute handle children?
Yes, yes. So as long as the children are able to cooperate, so we don't do very young children from like 0 to 5, where it's hard for them to kind of slit at the slit lamp, but teenagers, 12-year-olds, anyone that's able to kind of sit down and cooperate for the exam, we even take care of children. One of the things that we offer is called myopia management. So myopia is nearsightedness. So the prevalence of nearsightedness and the prevalence of people needing eyeglasses is growing at an exponential rate. So myopia management is where we can talk about different therapies so that the children's prescription doesn't rapidly increase and we can stabilize it so they're not going to be dependent on such thick glasses. So we definitely can help address that.
Dr. G, I got to tell you, kind of sucking up a little bit. I see why Wang Vision Institute has you on staff. You are amazing.
Thank you.
Tell people, besides we're running your number on YouTube, people who are listening on radio, how do they reach Wang Institute?
Yeah, so you can visit our website, www.wangvisioninstitute.com. Our phone number is 615-321-8881. So both of these ways are easy ways to reach us. Anyone can answer the phone for you. And then we also have on our website a way to send direct inquiries. So if you don't want to reach us through the phone, you can reach us directly through a website and we'll reach out back to you, help answer your questions. And the website
Real
also
quick,
has.
I just want to ask real quick, can people actually ask for you?
Yes, 100%.
Okay,
So
good. Wonderful. Well, listen, don't you ever leave Wang. I got to tell you, people love you here, Dr. G.
No, thank you. Thank you for having us. I really appreciate
We'll
it.
see either you or Dr. Jones next month. Thank you.
That's right. Take care.
That's Dr. G, the Wang Eye Institute. They are amazing. If you're in the Tennessee area, they're the people you want to go see. Hey, that's going to do it for us today. We'll be back again with you next week with more Ask the Experts. Thank you, Rebel.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.